So we'll continue on with the skeletal system in the cranium, with the skull. So remember yesterday we were talking about whenever we have a skull bone, we want to classify it as neurocranium or facial cranium, or sometimes, in some cases, both. So yesterday we ended on the zygomatic bone, which is the cheekbone. We're going a little out of order of our notes because it flows just a little bit better to kind of do the whole skull and then the neurocranium cap, and then come back around to the facial cranium because the temporal bone ties in with the zygomatic bone. So then the next bone we're going to flow into is the maxilla bone. You can also call this the maxillary bone. The reason I want you to be aware of it also being called the maxillary bone outside of just the maxilla is because when we talk about any process or whatnot, we call it maxillary process or what have you versus maxilla process. Now, the maxillary bone is I'm going to just flip back for just a second to this face-on view. The maxillary bone is this yellow bone here, and there's actually two of them because you can see in your notes that there's a 2 in parentheses. And so it has this kind of U shape around the nasal cavity, and it meets the two left and right maxillary bones meet right here in the middle and fuse between the nose and the mouth. So they're two separate bones. Before we get too carried away and too far into the maxillary bone, is this facial or neuro? Facial, obviously facial, yep. Makes up a large portion of our face. So the maxillary bone is facial cranium. It holds all of our upper teeth, so make sure you put that in your notes. The maxillary bone holds all of our upper teeth. So all upper teeth are maxillary teeth. Okay. When we talk about the teeth, there are processes, and a process is a slightly new term. A process is a projection of bone that comes off of a bone. So here on the maxilla, where the teeth go into the socket, they create these ridges or processes that stick out. You can take your finger on the outside of your upper lip and feel where your teeth are at. These ridges or bumps you go over, these are called alveolar processes. I'm going to skip back to that slide. So right here you can kind of see that they've got the ridges that are there. These are called alveolar processes. That's on our list here. Now, also more important with that is we have what's called the tooth socket. The tooth socket is called the alveolar socket. So for the teeth, you want to remember that you have an alveolar process, which is the ridge or bump on the maxillary bone. And then you have the socket that the tooth goes into, and that's called the alveolar socket. Okay. The good thing about this is you have lower teeth as well, and those teeth are set in the mandible. All of those lower teeth have an alveolar socket in the mandible, and you can see there are ridges here along the mandible, and those are also alveolar processes. So the name doesn't change whether it's maxillary or mandibular. So, and then just thinking ahead, we're not to the mandible yet, but those lower teeth then are all called mandibular teeth, where all of your upper teeth are called maxillary teeth. Okay. All right, so I'm going to flip back here for just a second. Some stuff we want to talk about on the maxillary bone. The first thing we'll talk about is this foramen, or this hole. So when we look at the maxillary bone, it creates the lateral border of the nasal cavity. It creates the medial and medial inferior border of the orbital socket. Well, in the maxillary bone on both sides of the face, right below the orbital socket, there is a hole or a foramen. This is the infraorbital foramen, infra meaning below the orbital. that is where the infraorbital vein, artery, and nerve come out of, and that nerve and those vessels give supply over the cheek area and kind of run up between the eye and the nose. And so I want you to be aware of the infraorbital foramen. So we have alveolar processes, alveolar sockets, infraorbital foramen. Then the other thing that I want you to be aware of when it comes to the maxillary bone is this is a view on the underside of the skull. The face would be facing up. Here's the back of the head. Here we have all of our maxillary teeth in this arch pattern here. The maxillary bone folds underneath and actually creates the majority of our hard palate. If you push up with your tongue, you can feel your hard palate in the roof of your mouth. If you curl your tongue up and back, you can hit this flap of tissue that has that uvula, that little thing, the ball that hangs down. If you open your mouth and say, ah, it dangles in there. That's your soft palate, where that uvula hangs. That's just muscle. But when you push up on the roof of your mouth, the majority of it is this hard palate. The majority of the hard palate is made up of the palatine process of the maxillary bone. So I want you to know that. So on this slide, this I believe is slide 27 for you. So on slide 27, you want the inferior view of the skull. So you want to put a star next to palatine process of maxillary bone, or maxilla. That makes up the majority of your hard palate. There's a couple other things I want you to know. There is a suture, the median palatine suture, where the maxillary bones fuse in the midline. I want you to know the median palatine suture. I want you to know the palatine process of the maxilla. And then right behind your two front teeth on the maxillary teeth, you have this incisive foramen, where we have some nerves, vessels coming out of. I want you to know those three structures on the maxillary bone. So those are the structures for the maxillary bone. Maxillary teeth, alveolar process, alveolar socket, infraorbital foramen, incisive foramen, the palatine process, and then the median palatine suture. Okay? Now, since we've worked our way from the cheeks down to the upper teeth, we'll work our way, and we've worked our way into the hard palate. Let's finish up the hard palate with the palatine bone. These are two L-shaped bones. I'll go to their slide real quick, which is right here. These are the palatine bones. There are two of them. They sit behind the maxillary bone. And these, where these sit, this diagram shows that like there's been a frontal or coronal plane that has shaved off the part of the facial structure, and you take that off, and then you can look inside the nasal cavity. So we can see these L-shaped bones sitting back behind the maxillary. They're not really neurocranium, are they? But you don't see them on the face, do you? But these are still facial cranium because they help push the maxillary bone out and give facial structure. So these are facial cranium. Okay? All right, now if we look at the diagram we were just looking at on the underside of the skull, we can see these two L-shaped bones. This is flipped upside down, so they're stuck in just like this. So we have the base of the L and then the upper vertical arm of the L that comes off the side. Okay? One other thing I want you to know about the palatine bone is it has this foramen in it called the greater palatine foramen, where we have nerves that come out underneath the skull. So right now we have supraorbital foramen, we have infraorbital foramen, we have the incisive foramen, and now we have the greater palatine foramen. And then if you add the foramen magnum, that's 5 foramen we're doing so far. We're not going to do all of them, all the foramen. Okay, so that's the palatine bone. The next bone I want to do, so there's our palatine bone. We've done the zygomatic. Let's talk about the lacrimal bones and the nasal bones. We'll come back up to the face for just a moment. I'm going to go for the face-on, front-on view. Now, the first bones are these nasal bones. There are two of them. There's one on the left and one on the right. They have a suture right down the middle. What do you think, neuro or facial? Facial, definitely facial cranium, right? So on that slide, go ahead and write next to them, facial cranium. Really, they do the bridge of the nose. They make up the majority of the bridge of the nose, and then there's a little bit of cartilage at the end, and that's their job. The other two bones that are on that same slide are the lacrimal bones. You can see them from the face on in the skull because they make up that initial medial wall of the orbit. I'm going to go to the lateral view that has the lacrimal bones on there. Okay, so there's two of them. There's one on the left and there's one in the right orbit, and they're right here on that medial wall. If you gently take your finger and push in on the medial side of your orbit, you'll push your eye back a little bit and it'll get kind of fuzzy, but you can feel there's a little groove in there. That groove is the lacrimal canal where the duct called the lacrimal duct sits, and it's a tear duct that drains your tears down into your nasal cavity. So if you ever get teary-eyed, if your eyes sweat, things of that nature, eye sweating's okay, but crying's a different story, right? But anyways, if your eyes sweat, those tears will run down into your nose and you'll get a runny nose. That's through that lacrimal canal into your lacrimal duct, okay? And that's how that happens. So those are present there. Okay, so right now we still have the mandible to do, and we need to talk about the ethmoid bone, and we need to talk about the sphenoid bone. And then we'll talk about inferior nasal concha and the vomer. We'll do that in a separate video.